For breathwork, we want to make sure that we have access to lots of different positions and ways to breathe. So this exercise is going to focus on learning how to breathe a little bit lower into your fingers. You're going to take your fingers and find the very front, the pointy part of your hip bones, and walk your fingers inside of those and maybe down just a slight amount. And you're gonna dig into those tissues as long as it's not painful. We wanna dig in so you can get a little bit more access to that position so that you can actually feel your breath come into your fingers. Now, the other thing I want you to pay attention to is that you are sitting here, sitting back into your sit bones and not kind of really far forward. If you feel yourself really tense, we need to sit back into more of a relaxed position. If sitting is too hard, we can also lay on our backs with our feet elevated and resting and our knees bent at 90 degrees. That would also be fine. Now, find those hip bones, go a little bit inside and down about an inch. Then from here, you're gonna keep your mouth closed and breathe in slowly through your nose, not quick. We're gonna slowly feel that breath travel down into our fingers and expand. Then we're gonna exhale and let it come out. We're not forcing it. This is an inhale focused exercise. So it's gonna look like so. Now, as you're doing this, you might feel that you feel expansion elsewhere. So you might feel that your chest is moving, your ribs are moving, your back is moving. That's fine. We just don't want to be doing this, right? As you breathe down, your lungs are expanding and you're going to get air in your lungs. So feeling movement there is totally fine. We just want to see if we can get the movement a little bit lower to really learn how to contract your diaphragm through its full range of motion. A lot of people, when they do this, will feel like it catches or stutters. That's just a sign you don't have the full strength there. We want to make sure that you just practice this and spend more time there and even add some pauses then at your position where you are fully inhaled. And then also, if you feel like you are straining and pushing, you are trying too hard, and that is a compensation. So don't try as hard. Slowly just feel like you can get your breath a little bit lower and lower. And over time, you should feel that you are able to get it finally into your fingers. And if you're not feeling progress there, then there are some other troubleshooting to do. So over time, make sure you're really practicing this and you'll build that connection. It just takes a little bit more time to build the strength of your diaphragm and kind of build that connection between your brain, your nervous system, and your muscles, your diaphragm. So be patient and consistent and try to see if you can get a little bit of progress over time, and you should notice that it starts to become a lot less challenging and a little bit more second nature.